Hi, good afternoon. I am Dr. Baker. I work for Align Modern Health as a chiropractor. We are going to be doing the group injury screening today for the neck and back. I just want to thank everyone for joining in and following along with this. So we will get started. So at Align Modern Health, we have a few different services that we offer, starting with chiropractic medicine. That is the team that I am on. We like to look at musculoskeletal pain, injury prevention, rehab, trying to keep people from getting in pain, and when they are in pain, getting them out, and then preventing reoccurrences of those pains. We also have clinical massage therapy, working on the muscles. Muscles move joints, so if we can work through the muscles, that can help with pain as well. We do offer acupuncture, and what acupuncture is going to look to do is pretty much work on anything. Our acupuncturists are awesome. They can work with everything and anything, including stress, anxiety, depression, all of that good stuff. Finally, we have the functional medicine. They are looking at the internal organs and the internal systems more so, working with diet, inflammation, things of that nature. So I got my doctorate degree at National University. I went to the University of Illinois to do my undergraduate, and I like to do more of rehab and muscle work in my treatment course. And I actually got into chiropractic through a hockey injury of my neck, so kind of fitting to be doing this webinar here. All right, so we are going to start with the neck, and I'm going to show these motions, every motion and movement we do twice. So the first time, go ahead and just watch and see how it's done. And then the second time, I will have you guys follow along, trying to feel for tightness, stiffness, pain, increase in symptoms, anything like that. So where we're going to start is with cervical flexion or neck flexion. So what you're going to do with this one is go ahead and just look down toward your chest as far as you can. So we'll do that one again, all together now. And go ahead and look down toward that chest. Here you might feel a little bit of stretching in the back of the neck. That's okay. But we're more so assessing for pain, increase in symptoms, that type of thing. The next motion here is going to be cervical extension. So what we'll do with that is just look up towards the ceiling as far as we can. And we'll do that one more time together. So go ahead and look up. You may feel a little bit of tightness in these muscles here. Again, that is okay. We're more so assessing for the pain, stiffness, tightness, all of that. The next motion we're going to do is going to be lateral flexion of the neck. So we will go to one side. And with this one, what's important to note or keep an eye on is your shoulder. We don't want that shoulder hiking up. We just want to bring that ear to the shoulder so we can do it all together. Again, you might feel a little stretching in here. That's okay. And then we'll also do that to the other side. So over to that left side. Again, you might note some stretching here. And then we will do that one all together. All right, so the next motion is going to be cervical rotation. So with this one, all you're going to do is try and look over your shoulder as far as you can. So I'm going to start to the right side here. And then we'll do that one together again. And now we're going to go over the left shoulder. So I'll show you that. And we can do that one all together. All right, you might feel a little tightness in the muscles here, no problem. The next motions, I'm going to turn sideways here. So what you're going to do is cervical retraction. So I'll show you here. You're just going to try and pull your chin back, keeping your head flat. You don't want the chin to duck down. You also don't want it going up, because then we're getting into the other motions that we already did. So just pulling straight back, just like that. And then we will do that one more time together, pulling straight back. With this one, you might feel a little stretching in the back or a little fatigue in the front. That's okay. The other motion is going to be going forward, almost like we're trying to jut our chin forward. So we'll do that one again together. Just jutting that chin forward. and assessing how that feels, if there's any pain or stiffness or increase in symptoms. So those are the motions of the neck. If anything came up with those motions, a little tidbit of information or something that can help is a stretch. So we'll do two different stretches here. The first one is going to be for the muscle that starts right here and goes into the shoulder, which is the trap muscle. So with this one, again, you want to focus on that shoulder not hiking up, because you're not going to get the full stretch in there like we want. So I always tell patients and suggest just taking the hand and putting it behind the back. So what you'll do is by putting that hand behind the back, it's going to keep the shoulder down, and then you will just lean straight across. So we'll do that one more time, and we can do this one together. So bring that hand behind. I'm starting on the left side here. Lean to the right, which would be opposite of the hand that's behind the back. And if you want, you can add a little tug. If you're feeling a good amount of stretch right here, you absolutely do not need to add it. But if you feel like you could go a little farther, you can add just that little tug to get a little extra stretch in there. If at any point you're feeling pain with that, you're stretching a little too far, so just back off a little bit, and it should just be a good stretch feeling, not pain at all. We'll do that on the right side. So I'll bring the right hand behind the back and then lean to the left. So we'll do that together now. So go ahead, take that right hand, put it behind the back, keeping that shoulder down, and lean away from that right shoulder. Again, adding that tug if necessary. If not, don't worry about it. It's not necessary at all. All right, the next one is going to be for the muscle that comes from here and connects up into the top of the shoulder blade. So with this one, again, we are going to want to keep that shoulder down. So I'm going to start on the left side again, bringing that left hand behind the back. And what we're going to do is rotate a little and then bring our nose down toward our toes on the opposite side. So my face is going towards the right when my left hand is behind my back. So we'll set that one up again. Take that left hand, put it behind your back, rotate towards the right, and then bend to the right. With this one, you can add that stretch again, right here, a little bit extra there. If you don't need it and you're feeling it pretty good right here, again, do not add it. It is not necessary. With that, you should feel that stretch more into here. We are going to repeat that with the right side. So right hand behind the back. We are going to rotate and look down toward the left toes. So we'll set that one up together. Bring that right hand behind the back, keeping that right shoulder down. Rotate a little, and then bring the nose toward the toes, adding that tug if needed. With stretching, anywhere from 15 to 30-second holds is good. You don't want to bounce. So when you're with this one, you don't want to kind of tug like that. That just adds a little bit of strain on the muscles, whereas we just want that nice, consistent stretch. So to segue into the thoracic spine or the mid and upper back, I'm going to talk a little bit about breathing. Breathing is a really important one. Unfortunately, most of us do not breathe correctly. We do a lot of our breathing from our chest here, which uses these muscles, which should be accessory muscles for when we are exercising, running, something like that, where those muscles need to help fill the lungs a little more. But on a normal basis, when we're just relaxing, we should be belly breathing. So I'm going to move back here a little bit and show this. So what you want to do is you can put one hand on your chest and one hand on your belly. So we want to concentrate on the belly expanding when we take that breath in. That means we're breathing with the diaphragm and the belly rather than with the chest here and using all these accessory muscles. So we're going to take a couple breaths here. We'll do 3. So go ahead and take a nice deep breath in. You should see that belly expand, and then out. All right, with that, it can be a little tricky, especially because, like I said, most of us are used to breathing through our chest. So if that was a little difficult for you, no worries. It is for most people. Really practice it. Focus on trying to expand that belly and getting that breath deep in that belly rather than up in the chest. I personally like it a little bit better laying down. It would have been kind of tough to get on camera, so I showed it standing. I think it's a little easier for the muscles to relax and people to really focus on getting that breath into the belly rather than in the chest. So you can always give that a try too. I think it's just a little bit easier. So next we are going to get into the upper back, mid back, or the thoracic spine. So with this, we're going to start with range of motion. And the first range of motion, I'll actually get up here, make it a little bit easier, is extension. So what you can do is hands across the chest like this, or you can also put the hands here. It doesn't matter, both work. So I'll show both ways. So the first one, you're just going to extend back, trying to get the mid back moving as much as possible. So we'll do that one more time. So cross those arms and extend back, more so in that upper back. And then the other way, I'll show you this way too, is with the arms, and go ahead and just extend back as far as you can. So we'll do that one more time together here. Hands behind the neck and extend back. With this, again, we're assessing for the stiffness, pain, tightness, increase in symptoms, anything like that. The next one here is going to be slump test, or going and getting into bad posture. Probably one of the only times you'll hear me to tell you to slump or get into that bad posture. And you just want to see if there's any tightness in the back muscles, any pain, anything like that. So we'll do that one more time. Go ahead and slump forward as far as you can. You can hold for a second or two just to see how that feels for you. All right, and then the next motion is going to be thoracic rotation. So what we'll do with this one, you can cross the arms like this. You can also cross them here. Again, it's the same thing. If you have a personal preference, go ahead and go with the one you like better. So what we're gonna do with this one is just rotate to the right as far as we can. And then we'll do that one more time together. Going towards the right, rotating as far as you can. We'll repeat that on the left. So I will do this one here, and then we'll do the next one together. All right, we'll do this one together now. And rotate as far as you can. The other way of doing that is like this. So I'll show you again pretty quickly here, just rotating with the arms up here instead. We'll do that one more time together. And now to the left. And one more time all together. All right, so that concludes the ranges of motion for the thoracic spine. With people working from home more so nowadays and a lot of sitting, one thing I really like for the thoracic spine is trying to do thoracic extension. When we sit, posture tends to fall forward. We kind of round the shoulders. It puts some pressure on the mid and upper back there for us. I preach posture every single day, talk to all my patients about it, and I still find myself at the end of the day like this. So nobody's beyond good posture, and it can always be something that's worked on. So I'm going to show you just a little something to help stretch out the mid upper back and work on that posture a little bit. So at home, if you have a foam roller or some sort of towel you can roll up, anything like that, what you'll do is put it on the top of the chair. And we're going to put it right behind the back. And what you can do with this one, again, you can do it two ways. You can cross here. My personal favorite is putting the hands behind the head just to support the neck a little bit. What you'll do here is repeated extensions over the foam roller. We don't want to go too far where we're getting pain or anything like that. It should just feel like a really nice stretch. It should kind of relieve a little bit of that tightness too. So I can show you here first, and all you're going to do is extend back as far as you can. And again, with these, we want to do them repeated because we sit like this for quite some time throughout the day. So just getting that repeated motion is really good for the joints and the tissues. And then the other way to do this, if you don't have anything to put behind the back, is if you just use a chair that has a little bit higher of a back, putting your back against it, and then you can do it just like that, getting that extension into that mid upper back. I'll show it again with the hands behind the neck, just extending back like that. With those, again, we want to do it repeated. It's going to help those tissues get stretched rather than just doing it one time. You shouldn't feel pain with that. It should be a good stretch. If you're feeling pain, you might just be going a little too far into that stretch. So go ahead and just back off that a little bit and take a little bit of that pressure off the spine. All right, we are going to move into the low back now. So the low back or the lumbar spine, we're going to start with the ranges of motion here. So I'm going to stand up and get back a little bit so everyone can see. So we're going to start with lumbar flexion. So going toward the toes. So what you'll do is just reach down toward the toes, going as far as you can, trying to stretch, feeling how that feels. So now we will do that all together here. Go ahead and reach down toward those toes as far as you can get. Don't stress it too much. So if you're starting to feel a little something, don't go beyond that. The next motion is going to be lumbar extension. So that's trying to come back this way. So I like to put my hands like this into the low back. You can also do it this way, but putting the hands there just adds a little bit of support. So that's why I like that. And what you can do is push those hips forward and then try and lean back. So we will do that all together. Push those hips forward and then just lean back a little bit, trying to go as far as you can. The next motion we're going to do is lumbar lateral flexion. So all you're going to do is slide your hands down the side of your leg toward your knee. So we'll do that one together, starting on the right side here. Good. Again, assessing for all the stiffness, tightness, pain, anything like that. Now we're going to do the left side. So again, just sliding that hand down the leg as far as you can. All right, we'll do that one more time all together here. Sliding that hand as far as we can get. All right, the next motion is going to be lumbar rotation. So with this one, you can put the hands here, or you can put them on the hips, whatever works best. So what we're going to do is rotate over that right shoulder. This time, we're going to try and focus on getting more of the movement from the low back here. So we'll do that one more time together and rotate toward that right side. Keeping the feet where they are. We don't want to move our feet at all. And we'll do that again, this time to the left side. And we'll do that one more time together and to the left side. Perfect. Next one is going to be side glide. So what you'll do is put your hand on your hip, just like this. And we want to try and keep the shoulders level here, where the last one, when we were going to the side, the shoulders kind of tipped a little bit. With this one, we want to push the hips, but maintain the shoulder height. Pretty equal. If it dips a little, that's okay, no problem. So we'll do that one again together and push those hips. Good. Now I'm going to push with the left hand, pushing those hips to the right. And push those hips, trying to maintain the shoulder level. And then we'll do that one more time together and push the hips. With those, again, all those motions, we're trying to assess if there's any stiffness, pain, tenderness, increase in symptoms, anything like that. So with the low back motions, now that those are done, I'm going to show you just a couple different stretches that I really like for the low back. And one for the hips, because the low back and hips work as a team. If one teammate isn't quite doing what they're supposed to, the other teammate has to pick up for it, and that can cause some issues in both areas or just one of the areas. So to start, I'm going to show you that hip stretch. So let me move my camera here just a little bit. I just call this the figure 4 stretch. So what you're going to do is bring your leg up just like this. And if you don't have the mobility or it's too painful to come all the way up onto this knee like this, you can go ahead and bring it down halfway down the shin, whatever is comfortable for you. I don't want you stressing it too much. So whatever you can get to, that's the range of motion we're going to work with. And that's where we'll start, and we'll try and improve that as we go. You can put a little bit of pressure on this knee here if necessary. If you're already feeling a really good stretch, this is not needed, but you can add it. From here, what you want to do is sit up nice and straight, so we have a good arch in the back. And then we're going to lean forward just a little bit and bring our chest up to the sky. So we're almost doing this to get a really good stretch in the back of the hip here. So where we should really be feeling this is kind of the glute hip area. So we'll set that one up one more time together here, bringing that foot up, putting that pressure on the knee if you need it. And then I'm just going to move forward here a little bit with my chest and then arch the back just a touch to get that really good stretch in there. Again, with stretches, 15 to 30 seconds is a good hold. I don't want you bouncing or doing anything like this, bouncing forward. That can cause some tissue damage. All right, we're gonna go to the other side now. So now what I'm gonna do is bring up my left foot onto the knee. Again, if you can't quite get it there, you can work with this too, down the shin a little bit, whatever works for your range of motion. Add that pressure if needed. We're going to arch that back a little bit and lean forward, almost like we're bringing that chest towards the sky. So we'll set that up one more time together. Bring that foot up as far as you can get it. Put that pressure down on the knee if needed. And then we're going to bring that chest towards the sky and lean forward just a little bit. Again, you should feel that stretching into this area, the hip glute area. And now we're going to move on to a stretch for the low back. So let's see if we can get this camera good. So with this one, what we want to try and do is you can reach over or you can reach to the side. I personally feel a little bit more of a stretch when I reach over. So what you'll do is reach over as far as you can to one side. I'm starting with the right hand going up in the air. And then you're going to rotate the shoulders just a little bit so this right shoulder comes forward. Where you should feel this stretch is right in this area of the back. So we will do that one together. So bring that right hand up or over, whatever feels best for you. Stretch to the side and then go ahead and rotate. Holding that 15, 30 seconds is good. We will do it on the left side now. So that left hand is going to go up or over. Again, whichever is most comfortable for you. So up, and then we're going to rotate that left shoulder a little bit forward. Whatever you need to do to feel that stretch in here. We'll do that one more time together. So bringing that up, rotating just a little bit here to try and feel that stretch as much as we can in that low back. All right, last but not least for the low back. With people working from home, a lot of sitting, something like this, a lumbar support, I think is fantastic. Because when we sit for too long, we typically lose our posture and we kind of get into that slumped position. What supporting the low back can do is help us from losing this natural curve that we have and getting into this position. So when we sit too long, we're more so in this position. And you can even kind of see here, I'll bring the camera up a little bit. When my low back rounds, see how my shoulders come forward and this upper back rounds too? That can add to tension on the shoulders, that can add to tension on the neck as well. So if we can get this back supported, that is going to help a bunch, keeping that back rounded, keeping those shoulders down and back, and keeping that posture really good. So that's another thing I really suggest for a lot of my patients, is trying to get some sort of lumbar support into that low back to help keep that posture. So when we sit for a while, we don't start to get this slumped over posture, helping maintain the best posture possible. At this point, that is all I have for information. If anyone has questions, feel free to post them in the Q&A section. I would be more than happy to answer as many as possible. If you have a more specific question or can't think of anything right now, we do have 15-minute free consultations. There's no obligation whatsoever. You're more than welcome to schedule one of those. You can do that by calling 312-216-2452. You can also visit alignmodernhealth.com. Both of those will get you to where you need to be. And we have clinics all over the Chicagoland area and into some of the suburbs, surrounding suburbs, so we can best fit you for where you are close to. So I just got a question for the breathing technique. So we're gonna go over that one more time. All right, so what you'll do here is one hand on the chest, one hand on the belly. So what you're trying to do is really get that breath into the belly and into the sides here, instead of the chest coming up. So I'll actually show you an example of chest breathing here. So if you see here, when I take a nice deep breath in, see how that chest comes up? That's what a lot of us do. We want to stay away from that. So what we want to do here is breathe into that belly more so. So go ahead and take a nice deep breath in. All right, just like that. So I hope that was helpful. And then for the roll here, the lumbar support, I mentioned this earlier, we do have these available on our website. So you can always look into that there. They're super beneficial. I have one myself. I use it in the car, and it is fantastic for keeping that posture. I got another question here for good chair support, a good chair with back support. So I can't give you a specific chair, but the best thing that you can do is get something that really supports that low back to keep that curve in there. So when looking into a chair, you want to make sure it has that support, okay? And then making sure it has that curve so we don't fall into this position. Of course, with the chair, you might fall into that position anyway after a while. Posture is one of those things you constantly have to work on to try and maintain it. So a recording will be sent out to the email that you signed up with. So this webinar will be available for you to see. All right, let's see. We're getting a few more questions rolling in here. So give me just 1 second to try and scroll down here. All right. So if you're trying to sit with a bulging disc injury, standing posture is my best bit of advice would be to try and stand with that low back curved a little bit to get that natural position in there. A lot of times disc injuries are because we bend forward and a like forward flexion type injury. So if we can avoid bending forward, that's going to be the best way to stand. Also, I know standing desks are the new craze. One thing to avoid or try and be weary of is don't stand all day either. Static standing is not great for the back either, just like static sitting. So the biggest thing is movement. So if we can try and get some movement throughout the day, that's going to be the best thing for that. So the exact position for the lumbar support, someone just asked. Let me move my camera here just a little bit for you guys. So where you want this is right about belt line. So I say that as a standard. Every person is a little different. So sometimes people find that it's a little bit better in a different position. So with this, it's really a test and see. So typically I tell patients to start right at that belt line at the top of the tailbone or the sacrum and trying to get that posture, and then you want to sit back to maintain that. If you feel like that's not as comfortable and you just need a little bit higher, you can do that too. But always that starting point is right at that belt line. All right, so I have a question about the best time to get up from a desk, especially after a knee surgery. So with timing, I typically recommend about every half hour, and it doesn't have to be anything crazy. Just get up and take a few steps. I've even told patients to put your water bottle on a table 10 feet away. So every time you need to take a drink, you get up, you move the 10 steps and come 10 steps back. It's nothing crazy. It's not like you have to go out for a 10-minute walk. Just getting up and that movement is the biggest thing. All right, I think that is it for the questions. So I just want to thank everyone for joining and tuning in to this webinar. I had a great time. I hope you guys got something out of it. We are going to end here for today. Have a great rest of your afternoon.